Hi everyone, welcome.
Welcome. We're doing another wonderful webinar. Thank you very much for joining us, Dr. Kiltz. I know our clients always appreciate it, and we love the Q&A.
Well, we're always glad to be presenting, and we're grateful to everyone for supporting CNY Fertility. And we've been 20 years and continuing to grow and see people from around the globe.
Absolutely.
And you know, one of the things we've really been focusing on is access, quality, and affordability. And really, everyone is welcome at CNY Fertility. Our job is to help you identify and treat the things that will help you, one, naturally conceive.
Yes.
And two, assisted reproduction is what we are really good at also.
Yes.
Integrating Eastern and Western in-house, but also working with practitioners around the world to add acupuncture, yoga, massage, food ideas, and the most high-tech, sophisticated, modern medicine today we offered at CNY Fertility. And so we're always listening and learning from our patients, and we're grateful to have a chance to be able to communicate.
Absolutely. We love to grow and we love to learn from you and to share all of our new ideas with you, because that's really what we do, is we grow and we change and we learn and we read, and we love to share it. So you can type in your questions in the question box. We will answer as many as we can. If you have any difficulty seeing or hearing us, please don't hesitate to chime in and we will adjust that. But go ahead and type your questions in and we'll get started.
And I'm Dr. Rob Kiltz, by the way,
Absolutely.
owner and director of CNY Fertility Centers. We have a great staff of over 250 employees,
Yes.
Team members, I should say,
Great
between
team.
physicians, practitioners, and financial counselors,
Yes.
and nurses, and Lisa Stack is our amazing support
Yes.
team member to help in these webinars. And
Absolutely. We have the webinars. We have in-house support groups at our centers. We also offer great free workshops throughout the month, webinars like this, and we also have peer support online on a closed Facebook support group. So if you're interested in joining that, you can contact me directly within your patient portal, or you may email me and I'm happy to add you to that. We have close to 300 women sharing every day.
And they could find that on the CNY Fertility
At the website as well.
And if you're not a current patient,
Yes.
we're here to take care of you no matter
Absolutely.
what. And simply getting information from
Yep.
others out there. How did you conceive? What did
Yes.
you do? And we're always doing free phone consultations, Skype consultations, and really sharing with everyone around
Yes.
the globe, and we're all learning together. So
It really is. It's a wonderful community.
So let's start into some of the questions. So again, type in your questions. We can see them here. Our next move is really to kind of take it back to sort of like listening to people bring it in. But let's start with the first question, Lisa.
Absolutely. So first question is, hello, can you tell me what is better, frozen banked egg program or fresh? I'm 45, I have 3 grown children and newly married, and I've had 1 fresh and 3 frozen failures. So fresh or frozen, what seems to be the best?
Well, our current rates really are doing about the same between our fresh and frozen eggs. One of the areas that we're really growing nicely on is if we have that sperm sample in-house, we can create those embryos at any time when the donors come up, and then create those frozen embryos and then have them ready for you in order to get you lined up and improve your implantation with either things like intralipids or Prograf or Neupogen. Our fertile food program, where we're really supporting more healthy fats, and healthy fats are pork fat, beef fat, butter fat, really amazing. But really, it's coming to the point where they're working nearly identical, and if you failed in some of these cycles, it might even be time to talk about laparoscopy, hysteroscopy, to look for endometriosis or pelvic scar tissue to try to find out, might there be some inflammation in your pelvis that can be cleared up and increase your chances for conception.
Absolutely. And the second part of this question is, how about with donor eggs? What's better, frozen or fresh donor eggs?
Well, I took that as frozen eggs and a 45-year-old. But even today, we're finding that frozen, thawed embryos do better in a so if you're doing a stimulated cycle and we're collecting eggs and making embryos, it's going to be better if we freeze those embryos and come back in another cycle to prepare your uterus, because the stimulation process seems to inhibit implantation. For donor eggs, since you're not going through the stimulation, whether they're fresh or frozen, it doesn't seem to matter very much. The key is we want to make sure we're not just assuming it's an egg problem and missing the opportunity to improve the body, the pelvis, the uterus, in all of this.
That's great. The next question is, my husband and I just had our second failed IUI with injectable medications. She has endometriosis and only one fallopian tube, and her husband's sperm count post-wash have been about 8 million. Does it make sense for us to continue to try IUI, or should we move on to IVF?
Well, so failed IUI, and a history of endometriosis, and some sperm abnormalities. And so I always say you always have to assume it's the sperm, the egg, and the body. And you have to approach them on all sides. And so the laparoscopy, hysteroscopy, and treating the endometriosis, changing the food plan, and changing the flow of energy through the body, male and female, is critical. And it may be simple, again, as adding more fat. The laparoscopy to either treat the endometriosis, treat scar tissue, or in some cases remove a damaged fallopian tube, which may be harboring a lot of inflammation, whether it's infectious or it's just immunologic due to the body's reaction to either food or environment or stress. Really a critical approach here. We even have some that'll look towards a gestational carrier. But again, you want to make the best embryo by improving the sperm, improving the egg. We recommend CoQ10, fish oil, vitamin D, folic acid, also as some supplements to help aid for the men and the women. DHEA to help with the eggs, another added supplement that can really help. So the addition of IVIG and intralipid, and I'm going to be repeating myself a lot in this conversation because my current understanding of infertility is the foundation of the majority of causes are inflammation. And we can't be ignoring that for either the man or the woman in this treatment. And you might be using donor eggs or even a gestational carrier. You want to consider those on all sides.
Great.
So again, laparoscopy, hysteroscopy, I think it sounds really important. Working on reducing inflammation, and then IVF definitely can overcome what you're missing with IUI because we don't know if the egg and sperm are even getting together. And the best way to understand that better is to do an IVF and put the egg and sperm together, look at the quality of the egg, the quality of the sperm, and subsequently the quality of the embryo.
Wonderful. The next question is, what are the success rates for FET versus fresh embryo transfer?
So frozen embryo transfer versus fresh embryo transfer, ultimately all that's going to be defined based on the woman's age and other factors that may go along with it. But basically, today, the frozen embryo transfers seem to be doing better than the fresh, and under 35, we're in the 60% range for frozens and the 40% range for fresh, actually even up to 50% for delivery rates in our 2014 data, and which is really interesting. If you look at SART and CDC data, you're finding that the differences between any of these programs is really not different if you take into account weight and economic status and other comorbidities, that really populations are so different between Boston and Syracuse and New York and Los Angeles. It really is something that the data doesn't carefully show you. Well, what are the real numbers? Plus, who are we accepting and allowing to do any fertility treatment versus someone else? And I know in our hands, we work diligently to help people conceive naturally first, and even laparoscopy still utilized a tremendous amount in seeing so many people conceive with that. But in general, expect frozens to be better than fresh when you're using your own eggs in a stimulated cycle, and fresh and frozens are going to be about the same. But another interesting component to that is, if you're only doing frozens, there are many people that are not going to get embryos to freeze because of bad quality egg or sperm or embryo. So they're being eliminated from the numbers. And so it may be the frozens are all you're going to see of those that make frozens. And in some cases, you're not even going to know who had embryo biopsies in PGS, where we're eliminating embryos that might have had a chance to become a baby, but we threw them out because we felt they tested abnormal, when in fact the tests aren't always that accurate. Absolutely. We have to be very careful about that.
Great, thank you. So the next client will be 40 tomorrow. Happy birthday.
40's young.
40 is
a lot of
young.
babies at the age of 40.
So she looks like she's going to be an out-of-town client, and wondering about the communication. How do we treat clients from out of town, and is that a seamless process? Is it stressful, or what does it look like?
Well, we have a great global team that communicates with clients around the world. My cell phone is always available. I get texts and calls, and really that's our largest part of what we do, is see patients from out of our local area.
Absolutely.
One is we are the most affordable. We offer a payment plan that makes it affordable to do your fertility treatments. And the communication is really Lisa, myself, and our global team, Donna, Greta, Justine, Trish, and occasionally I'll get a text, I didn't get a call from the person, and really that's the best way that I can make sure that we're all communicating. What usually happens is, I tried to send her a message, it didn't go through, and the disconnect here is that we're available 24/7. I talked to a patient from South Africa, from Nigeria, from Dallas, and it really is, fertility is global. A lot of it is because quality, you sometimes have to travel, but more than anything, our mission is affordability and access no matter who you are.
Absolutely.
And that's really the key to this.
Absolutely. We see travel clients from all over the world. We work very closely with your local OBGYN. Our dedicated team of nurses will communicate with you and your physician or laboratory to exchange any sort of testing that we might need to have done. And we'll be able to really treat you completely remotely for most of your cycle. The second part of the question was whether we do Skype consultations and possibly on the weekend, because she works 7 to 5, and we can easily make that happen.
I do free Skype, free phones, free face, and really it's a coaching experience.
It is.
Because my job is to listen and learn, and potentially coach you in some ways that, wow, it just happens naturally. But if not, it really is pretty simple. I mean, we're talking here, and we're gaining a tremendous amount of information. Our website has a tremendous amount of information. But simply, I was talking to a client in Russia the other day, or one in Spain, and the traveling around the globe is really easy. And our location here in Syracuse, it's low stress. We have a full integrated spa. We have local hotels that will shuttle you back and forth, and we work really well with them. And so, you know, we also help people through their consulates and get the appropriate visas to travel. And so this is really a global medicine today, and telemedicine is easy, and we're here to help, and that's kind of my mission in life, is access, affordability, and the best quality.
Absolutely. So the next client just started the keto diet 2 weeks ago. Are there any stats that show that this actually helps with egg quality? That's her question.
So are there any statistics that ketogenic diet helps with egg quality? Well, I don't have a published study that is prospective, randomized, double-blind, placebo-controlled. All I can tell you, I didn't believe this stuff one bit. And about 2 years ago, a bunch of my patients were doing this food plan and getting pregnant, despite the worst eggs, no eggs, the worst embryos, multiple miscarriages. And I'm like, okay, I don't believe this. So I personally did it, and I'm amazed at it. And we have been getting so many text messages and notices, and keto baby.
Beautiful keto baby.
And so really, for me, I don't need stats or studies. I'm listening to clients that it's just happening. Now, we are currently, Julia, one of our students who's working with us, is helping us put together a study. And what we're interested in, if you conceived by simply changing your food plan and going keto, which is a high fat, low to no carbs, and even checking your ketone bodies, we want to hear the story.
Absolutely.
And for us, it doesn't matter if it's natural or doing assisted treatments. We've been pretty amazed at it and really excited about this. And I've been a broken record, and people sometimes want to like shoot me for this conversation, but it's fertile fatty foods first, and eat a vegetarian, not to put anything against vegetarianism. I talk to my vegetarians that you need to add fat, butter, coconut oil, and ghee. So it may really be we've lowered our fat consumption so much, everything else is sugar pretty much.
Absolutely.
And all the sugar causes inflammation, causes all the diseases we suffer, and infertility happens to be one of those. So I'm probably going on and on and on, but I'm really like a little kid in a candy store that I found something that if you can do this one thing, it's been pretty amazing how it changes sperm quality and quantity, egg quality and quantity, and conception and delivery rates. Maria Emmerich, Gary Taubes, Jimmy Moore, just to name a few, Eric Westman, Richard Feynman. I'm just find it so fascinating how 99% of what we consume as healthy, vegetables, grains, fruit, fiber, are all sugar. And insulin is our killer, and by having too many meals a day, our insulin level is way too high, glucose is way too high, and that seems to be the culprit.
Wonderful, thank you. So the next question is, I plan to start my first IVF cycle in October. Do you recommend any supplements or vitamins to start taking now?
Well, fertile fatty foods first, fish oil, 3 grams, CoQ10. Look at Theralogics, it is a great CoQ10, and some other supplements. 200 to 400 milligrams. Vitamin D, 2,000 to 4,000 units a day. If you have diminished ovarian reserve or you're concerned about that, DHEA. For the PCO metabolic syndrome, and I believe most of us suffer from that because of a high sugar diet, Ovasitol, metformin really are very helpful. I think I've covered most of those.
I think so.
And looking at some antioxidants are very helpful. My take on it is you don't need all the antioxidants if you really, really lower the sugar content in your diet.
Absolutely. So going back to the keto diet a little bit more, the next client and her husband can't cut the keto diet. They tried and failed miserably. What are other ideas for keto failures heading into an IVF? And when are intralipids used? She just had a successful fresh embryo transfer cycle that sadly is just ending in miscarriage.
So intralipids is a fat emulsion that we use intravenously. I've been recommending it for not just IVF, frozen embryo transfers, but IUIs and actually natural conceptions also. So the idea is that the fat reduces the inflammation. And so Keto failures, I mean, we're all keto failure at some point. Carbs we're addicted to because they get us fat.
Yes.
And so really it's to get a trash can, throw everything out. Now, if you can do bacon, eggs, butter, and beef, really focus on that.
Yes.
Above ground carbs, now I'm going to say the greens may have too many phytochemicals, too many things that are antigenic. It may be things like rice and potatoes might even be better if you need to do that. But I'm learning that I still don't understand it completely, but fatty fish, fatty meat, butter, bacon, eggs, whole cream, full whipping cream. It's crazy. I have that as my shot. Smoothies out, protein shakes out, protein bars out. But it really is, as you begin to read the information, you'll begin to get it. But you got to read it, you got to listen to it. So I listen to these books tremendously, and I'm testing it out. One meal a day, every 24 hours, or 12 to 24 hours, so morning and night, and you want to sleep on your food, really helps a lot. But those are kind of the books that I've been recommending. Maria Emmerich has a really great cookbook. Partly what we're trying to do is add too much variety to our diet.
Yes.
I believe that the variety in our gut ultimately adds too many antigens that cause a lot of antigen-antibody reactions, that it's the gut that causes the pelvic, the full body inflammation that is our only problem.
Absolutely. Anecdotally from our clients, our Facebook page is actually a great resource for that. Many clients are doing the keto diet together. They're encouraging each other, sharing their favorite recipes or how they're putting these foods together to feel satiated. And really, when you're in that first week and you're cutting those sugar cravings and you're making that transition after you throw everything away, many people we talk about their favorite thing to do is the bulletproof coffee, or if you have coffee or tea, putting a nice heavy dose of heavy whipping cream in it, and even whipping it without any sugar or sweetener, but putting the whipped heavy whipping cream in your coffee or tea and a dash of cinnamon. If you're getting that and you're getting those fats, you're going to cut out your sugar cravings and your carb cravings. You'll feel satiated and you'll feel full, and you will find those cravings that you normally would get from maybe an Atkins type diet when you have to go through those first 3 or 4 days that are terrible. If you have enough fat, you're going to cut down on those sugar cravings.
And that's really important because it's the fat that reduces inflammation and satiates.
Absolutely. Anytime
you eat a carb, we're addicts. And our body's going to let me have more. Gimme. And so the Atkins was a great idea, and Robert Atkins did some great things, but the Atkins diet is a whole plan.
Yes.
And in my mind, you want to go ketogenic for life.
Absolutely.
And occasionally add that other stuff. Now, the interesting part is plenty of people get pregnant without this diet.
Yes.
And most people who smoke don't get lung cancer, but we don't recommend it. What I'm suggesting is a total change in our consumption of food in order to shift our bodies to allow natural fertility. And at the same time, what do I do to prepare my body to do assisted reproduction?
Yes.
That's really the key that we do a lot of. I mean, we're the 9th largest IVF center in the nation, and it in a non-mandated state because and our numbers are comparable to the top centers in the nation. And we don't select. It's that selection that seems to be the challenge in our business.
It is, definitely. How much does hypothyroidism affect success rates of IVF? Well,
hypothyroidism, I think this is Wendy asking this question, and hypothyroidism is very, very common. And it's interesting, you could have a normal TSH and thyroid 1 minute at the start of a cycle, and 2 weeks later, it's way out of control. Stress, food, inflammation. So we're looking at, before pregnancy, we'd like that less than 2.5. We're going to push it more and more. We're learning even more information on how to do that. And the fats may help with that, and for some reason, as you're going through the process, that the antigen-antibody reactions are basically blocking the function of the thyroid, which makes your thyroid function go down, TSH go up, and we all get stressed in this. Adding even subclinical thyroid disorders where we add a little bit of TSA, of synthroid, armor thyroid, a more natural desiccated might be better in this. So I think that's the part we need to be a little bit more open to, is the natural desiccated thyroids from pork thyroid as an option in all of this.
Great. Ashley is wondering more about freeze-all cycles. She heard about it during our last webinar and would like you to expand on that a little bit.
Well, eventually freeze-all is going to be the way we're probably going. We still offer fresh transfers because our clients all aren't ready for that, and we understand that. And plenty of people still get pregnant in a fresh cycle, but the freeze-all is probably our future because anytime you take these gonadotropin shots and stimulate the ovary, you may be putting the uterine lining and the egg embryo out of alignment, so that you have an embryo that's a day 5, but you have a lining that's a day 7. And so we don't always know how or why. So by freezing embryos, and what I've been recommending, if you have 4 or fewer embryos, we freeze on day 2 or 3. If you have 5 or more, we tend to push to day 5 or 6 or blast stage. And both ways work, and we individualize this, and we then are moving towards either a natural cycle for a frozen, letrozole, or where we trigger the ovulation with an HCG or a Lupron shot, or a medicated cycle where we have different regimens for that, either the birth control pill followed by Lupron followed by estrase, where we may actually do a hysteroscopy biopsy, add the immune treatments, and modify the whole environment at the same time. And we may or may not, it depends on other factors, add embryo biopsy, we do PGS in all of this. And so all of these factors, although they might take more time, and in some cases add more cost, it ultimately seems to increase your chance of becoming pregnant, delivering a baby in any one cycle.
Great. Can you do an IUI if you have had your tubes tied?
So an IUI if you've had your tubes tied, well, the sperm that either is ejaculated in the vagina and then swims up through the cervix has to get out into the fallopian tube, and it's in the fallopian tube where we believe most fertilization and early embryo development take place. So if your fallopian tubes are cut, tied, and blocked, IUI isn't going to work. Now it's interesting, I did a reversal on someone recently where one of her tubes was open when I did the reversal. So she thought she had a tubal ligation, but one of them was open. So I guess there's going to be someone that you do the IUI and it wasn't really blocked, it was open. Of note, we're doing reversals in our Syracuse office. It's about $7,000, and it includes 2 IVF cycles for the if you do not conceive or do not have a successful reversal. And that's for both vasectomy reversals and tubal reversals. So
wonderful.
IVF is for a tubal ligation or vasectomy. But if for some reason you have those reversed and it's not working, then IUI is certainly a part of the process. So, and I wanted to mention one other thing about the frozen, that if you're doing a natural cycle IVF, or we're doing a lot of natural cycles, allowing the ovulation, the development of the egg to happen naturally, monitoring with ultrasound, when the follicle is about 16 to 17 millimeters, we give a trigger shot and then retrieve the eggs 36 hours later. We can retrieve that egg from a natural cycle, make an embryo, and transfer it and not have the same factors we'd have in a stimulated cycle. And we're doing a lot of those where we're doing a single cycle, and our IVF pricing is less than $3,900, and we're doing a lot of cycles where we do for $2,900, where we can actually just do a single transfer and no freezing, which really makes it much more affordable in the process.
That's great. So Stephanie is wondering about PGS. Could that damage embryos that otherwise would have been good?
Recent article in Fertility and Sterility by Dr. Kushner in New York suggested that PGS may be harmful to many embryos and may give us inaccurate data. So I don't think we really could take it as it's safe for everyone and every embryo. Yes. Anytime you biopsy an embryo, there's some potential risk to that embryo. So I think we don't have the absolute answer. We do a lot of PGS, a lot of embryo micromanipulation. We think that the more experience you have, that's going to be a little safer to do. But the other interesting part is the actual results may not be 100% accurate. So I'm always concerned that we're going to be biopsying an embryo, freezing it, and then if it comes back abnormal, throwing it out, and never giving an opportunity to become a baby. Where what's interesting is that there may be some self-corrections to an embryo. Yes. It may be some mosaicism that some of those embryos, the cells that we removed are abnormal, but the embryo is actually normal. So the answer isn't there, and my bias is the answer will never be there, because we still want to help people have babies naturally without all this testing. And so it just adds another level of confidence improving the outcomes.
Wonderful. So Amanda is a new client awaiting her consult. She's had 2 failed IUIs and is looking towards IVF, as she only has 1 tube post a tubal reversal and a low sperm count and volume and morphology. What should she do to get ready for IVF while she's waiting?
So the preparation of IVF is really global.
Yes.
Everything we can do to, one, work on the mind and the emotions, and journal, write, talk, meditate, yoga, walking, listen to a good book or read a good book. Werewolves and Zombies isn't where I recommend. And so what you put in here vibrates to all of this.
Yes.
What you put in here is the other part of it. And fertile fatty foods first, amazing. Ketogenesis, that's really the focus. And anything we can do to reduce inflammation. Look to see if there's evidence of yeast infections or bacterial infections that, if they're not treated with natural methods and dietary changes, may require surgical intervention, laparoscopy, hysteroscopy, do an endometrial biopsy, do a culture, look at the morphology and the pathology to look for the inflammation. We're using more and more antibiotics for a week to 4 weeks, doxy or azithromycin, which can be really helpful. And a number of our clients have just done antibiotics for a few weeks and then conceived. Yes. So I believe all of this is in preparation for that cycle. And consult with one of our practitioners or physicians or myself, and share it on our Facebook website. And really everyone's welcome to join that. And we're working on making it easier to get into our portal and to communicate globally in all this. So did I answer most of those questions?
You definitely did. For getting ready. So the next question is, Melissa just ordered her medications for her IVF cycle. Can you please explain the use of Lovenox during the cycle?
So Lovenox is a blood thinner, and the concept to inflammation is that inflammation triggers the complement cascade of blood clotting. Coronary artery disease and stroke is not caused by fat or cholesterol. It's caused by inflammation. The inflammation which causes a complement cascade, which causes thrombosis, and we believe the thrombosis happens in the placental bed, in the uterine vessels, in the testicular and scrotal environment.
Absolutely.
And by using Lovenox and baby aspirin, we're going to affect that cascade and reduce the microvascular clots. And it seems to also reduce the inflammation. And aspirin used to be used in high dose to treat diabetes.
Yes.
And so it's kind of really an amazing process. We use it for heart disease, and so the Lovenox is another treatment that we add to either idiopathic infertility. We're idiots because we're not open to the possibility that it really is inflammatory infertility, which is, I believe, the global picture here, inflammation. And if we can work on the inflammation and adding things like Lovenox, aspirin, Prograf, Neupogen, intralipids, fatty foods, IVIG, where we're seeing so many successes. Recently, we had a client who did LIT therapy with the Markham Center in Toronto, leukocyte immunotransfusion. The partners or donors' blood, white cells, injected subdermally. It's not legal in America for, I don't understand the reasons, but that's what it is. You can either go to Nogales, Mexico, or to Toronto, Canada. And again, I didn't believe in any of this stuff. I didn't believe in the immune process. But as I worked with Dr. Braverman, the Beer Center, the Markham Center, and others, we've come to embrace it, and CNY Fertility really focuses on immune etiology first. Lovenox is one of the foundations of helping the immune system reduce the inflammation and the blood clotting in those microvascular spaces.
Absolutely. Thank you. So is it safe to continue vitamin D and CoQ10 vitamins after having the methotrexate injection?
Good question. Well, the folic acid we like to stop because the folic acid seems to inhibit the effects of methotrexate, which is generally to clear away a suspected ectopic or a known ectopic. And staying on those medications, I haven't heard of a contraindication, so I think in general, sometimes what happens is stop all your medications rather than going through the list. What medications are you on? Okay, we want to make sure that stay on this and stop this, and I think that's one of the things that we're all working to do, and it is important for us to hear from you. Hey, I didn't hear about this or that, or maybe the communication was wrong, or I'm feeling left out. 315-416-9872. That's my cell phone. I may not take it directly in that I answer back directly, but if I don't, and I almost always do, I pass it on to our team that's able to learn what we need to do to make sure you get the very best care in the world.
Absolutely. Can you use IVF prepared sperm for an IUI?
IVF prepared sperm for an IUI. It can be used. In general, IVF sperm is lower quantities, lower count, lower motility, but it's acceptable for IVF because we only need a sperm per egg. So if we find 10 motile sperm for 10 eggs, we're in good shape. Now, it doesn't require motile sperm, by the way, so be careful about that. But if you're doing an IUI, you typically want to prepare the sperm for an IUI or IUI ready, but it doesn't mean it can't be. It's going to depend on the quantity, the quality, and the count. But I've seen plenty of babies with the lower sperm count with IUI, so don't negate that it can happen.
Absolutely. So Stephanie is wondering about her husband's low sperm count and low motility. Have you been successful with IVF cycles with men in similar situations? So an 8 million sperm count and a 0 to 1% motility.
So IVF with ICSI, so in vitro fertilization, where we collect eggs, we take the sperm. Sometimes we're using some additional methods of collecting the very best sperm, where we then cut off the tail and inject it into the egg. So really, you can have almost no motility and extremely low count to be successful with IVF.
Great.
IVF with ICSI, where we inject the sperm into the egg, was created for this exact very reason.
Great.
At the same time, we've been working with men and our diet, adding HCG injections, adding Clomid or letrozole to help boost the sperm production and function. Acupuncture, light therapy, all are additional methods that can be very helpful, and a varicocele. So where the veins are dilated in the testicle, which creates an environmental change, whether it's heat or other inflammatory processes that adversely affect the sperm or the sperm production, can be repaired, that can boost the sperm function and production.
Great. So Brandy,
really good questions, by the way.
They're really great ones tonight. Brandy was supposed to go in for day 2 to 5 testing and HCG after her initial consult. She got pregnant naturally, which resulted in a chemical pregnancy. How long after a chemical pregnancy can you start the testing again? Can you go next month, or should she wait a few more months?
No, you can get started right away, because my sense is that, we used to just say, well, give it a few months and keep trying.
Yes.
But we weren't doing any interventional methods, especially when it comes to stress and food changes. Now that we're focusing on that, and we believe the early pregnancy support is critical. So at CNY Fertility, what we're working to do is not only help you get pregnant, or if you're getting pregnant naturally, it's to stay pregnant, where very early on, even before you know you're pregnant, we want to be doing weekly intralipids. We might be wanting to add IVIG, or adding the Lovenox and baby aspirin. And then we're adding boosters of HCG. So catching this early, and really what we want to do is follow your biochemical so it's all the way down. And then literally, we may even say, okay, with the next cycle, let's get you an intralipid weekly. And it's simple infusion that's not very costly. And we've seen so many, in England, I learned a lot about this. They call it mayonnaise babies. And so it's infusing fat. And so whether you're infusing it or you're eating it, and Dave Osprey, the Bulletproof Coffee guy, really amazing guy, his wife ate butter, and by simply eating butter, she conceived and had a baby at age 41, her second. And so it's, the girls like to call it a bacon baby. We're bacon babies, and eating bacon and butter makes a baby. So I hope that answered the question.
Absolutely.
But it really is, this isn't to say call us later. It really is, it's an ongoing supportive process that is very critical. And we work with your perinatologist, your OBGYN, and your family practice docs and your urologists.
Absolutely. So the next client is 30 years old with PCOS, and she's had 3 chemical pregnancies with IUI and letrozole. What can she do differently to achieve a pregnancy and hold on to it? Should she do another IUI or move on to IVF?
Well, so PCOS, or polycystic ovarian syndrome, has some dysfunctional ovulation. Metabolic syndrome is a high carbohydrate sugar diet. It is high inflammation. Some of the things that I recommend are, number 1, Ovasitol or metformin or Glumetza. And again, Theralogics, that's where you find Ovasitol. It's better tolerated and may have better outcomes. A ketogenic food plan, critical. Okay? And then a laparoscopy, hysteroscopy can really help in looking for endometriosis. We've worked with many docs. One of our docs down in New York, Dr. Vidali, does a lot of laparoscopy. We're working with some local doctors, but global doctors. Your OBGYN doctor can help with the laparoscopy, ovarian drilling, and hysteroscopy to clean things out. And then the next part of it is how to improve ovulation. And if it doesn't happen naturally with those methods, that's where letrozole comes in, and monitoring ovulation, triggering ovulation with HCG or Lupron trigger, and then following that up with intralipids, progesterone supplementation, really checking the thyroid carefully, making sure the thyroid is in good shape. It's really the parts that we're focusing on in this. So the PCO is anovulation, it's metabolic syndrome, helping immune side, helping with ovulation, and then helping in the support of early pregnancy with intralipids and Lovenox and Nuprogen Prograf, I think are really part of that whole global support plan. And don't forget, talk to someone, share your feelings, share your emotions, because the emotions really can kick our butt in this and make it really hard. And be easy on your partners, by the way, and partners, be easy on the partner that's working to struggle to get pregnant.
Absolutely.
That's a really important thing. And I think if we all talk in this, because we're just human beings, and the struggle and stress of this is tremendous. And we have a great Fertile Friends program.
Absolutely.
And our Facebook group, share with our Facebook group and share with your friends out there of what's going on. When you release it, it makes us feel a lot better.
It really does, absolutely. So Nicole was wondering if we could please explain the fertile diet a little bit more specifically. Which foods do you consume, which do you avoid, and when should you start, and for how long?
Oh boy, which is the food plan?
Yes.
And the crazy part is so many people eat junk and have babies, and it's like, well, what's going on?
Yes.
I don't know. But we've been working this plan, and I try to keep it really simple. Variety is killing us, all right? Narrow it down. Be boring for just a little bit. 30 days. Bacon and eggs. Put the butter. Put the eggs in the fat. Eat it all right? Have some leftover steak, but you got to get the ribeye. Tenderloin is lean. Chicken is lean. Fatty fish. Pour butter all over it. Cook it in bacon grease. Cook it in butter and coconut oil. That's how I say it's the really simple.
Yes.
Get rid of kale, rice, pasta, bread, yogurt, milk, grains. All right. Oh my God, I can't do that. How do I do that? All right. You want to have a baby. We're just going to take it simple.
Yep.
It's the baby diet. Bacon, eggs, butter, beef, yes. All right. Got to put a Y there somewhere. Not yams, by the way. And so add more of the fat. Yes. Maria Emmerich has a great book. The challenge is for everyone. Very few people are going to support no vegetables and fruit and grains. They are only sugar. Hard part. Sugar, bad. Bacon and eggs, if you can do that, you rock on. And guys love this much more than the gals. But you know, I'm only sharing a story that I've seen work time and time and time again. I just turned 60. I'm a little neurotic and high energy. Everyone knows it. But this food plan has just changed my life.
Absolutely.
Slow down. Walk with your partner or friend. Listen to a positive book. But really it is, you know, I'd be glad to even do a food plan consultation. I do those all the time now. And we're working with our team to share it.
Yes.
Chicken, you know, it's lean. It's not good for you, I think. Fatty fish, salmon, cook it in the grease and the fat.
Yes.
Again, it turns out fat reduces inflammation, it'll get you pregnant. And you're preparing for IVF, it'll do the best. And I know I'm boring on this, but I have one mission. Help you have a baby with or without me. Absolutely. That's the key. Absolutely.
Well, thank you. The next client, Brandy, is wondering if you recommend any probiotics for inflammation.
You know, I read Perlmutter's and Davis's book and all this probiotics. You know, why are we putting bacteria in our gut? All right, yeast and bacteria are what ferment things, make alcohol and inflammation. I'm convinced not at all. All right, and I'm convinced that fiber in our gut is the fuel for the fire of inflammation. And why would you do it? It's like a compost heap. the compost heap gets hot and smelly and inflamed, who doesn't have hemorrhoids or irritable bowel or colitis or polyps? All of us do. Yep. And literally, I say if you get rid of all the fiber and all the fruits and vegetables and eat a high fat, literally 80% fat, 20% protein, and like almost zero carbs. Now, I can't do it. You can. Test it out, see how you feel.
Absolutely.
And then the one meal a day, if you're doing your carbs at night, and personally, I'm beginning to think that the simple sugars, fatty ice cream, are actually better because the fiber isn't metabolized. The fiber causes the inflammation and the fire that you have to switch out and use probiotics to change it. But in fact, my bet is you don't need any of that stuff.
Great, thank you. So the next client just had her 6th failed transfer yesterday. 3 fresh cycles, 3 frozen cycles. And from all of those, she had 1 with a 5 cc embryo and all the rest, 1 chemical pregnancy with a 5 cc embryo, all the rest big fat negatives with a 5 BA and 4 cc. She's doing intralipids, Lovenox, HCG washes. She's done CoQ10. What else can she do to get ready for these cycles?
Well, I've won several patients, I should say, that only when they were in ketosis did they deliver a baby. Every other time they either miscarried, failed to implant, and so it seems radical. Do the fertile fatty foods first. Go ketotic, all right? Next is laparoscopy for endo adhesions, hysteroscopy biopsy. By doing this, we really improve things. The next is really think about IVIG and LIT. We've had so many of our patients, for whatever reason, they need the big guns. And they're not so big. It's amazing. IVIG is used for so many autoimmune diseases today. And I learned about it because of Crohn's patients that would do this IVIG for the Crohn's and then get pregnant and deliver a baby. And yet our industry, our evidence-based medicine says, no, there's no evidence. But as I learn and read and recognize, the foundation is inflammation. Be aggressive with Tricolamus, Prograf, Neupogen, both intrauterine and sub-Q. Lovenox, go to 30 to 60, even 80 milligrams a day. It really helps. And don't give up. And I know that the quality of the embryos we always have to be a little careful of because I've seen the worst embryos become babies and the best not. And it really is a matter of making the embryos and banking them and keeping at it. And that's one of the things that we've been able to be so successful with, is that we allow people to do whatever it takes. We don't say, oh, I'm sorry, you got to do donor eggs or you got to go. We allow people to do multiple cycles until it works. And it's changing it up, being always open to changing it up. And we respect many of our colleagues. We've had clients who have gone other places and conceived. We've learned from those. We've had those patients who have come to us and succeeded. So we're all open to learning new ideas, and our patients are sharing them. Our clients and our colleagues are Norm Gleischer really has an amazing website, shared some amazing things, and Jeff Braverman, the Beer Center, the Markham Center, but it really is be open to what others have to share, and you'll learn something amazing.
Great, thank you.
We have a few more minutes, and I really apologize we're not able to answer all of these.
I know.
And really, the themes are the same. Keep on sending me questions and ideas where you would like me to focus on helping answer some questions.
Absolutely. So we've had many similar questions. This one is a new one that's interesting. What A1C level do you recommend for best success for a diabetic to conceive either naturally or with IVF?
My sister had diabetes, and she passed away at 52 from cardiovascular disease. And I can tell you that it was really a very difficult disease. And the microvascular changes are from the immune system. That we know. And so less than 4.5, my concern on the hemoglobin A1C is that our numbers are based on our standard American diet, which is sad.
Yes.
And so I don't think we really even know what that right level should be because everyone eats so much sugar, it's a challenge.
Yes.
And so definitely below 4.5, but maybe it's even below that. We've had some patients do the keto paleo, and I say paleo a little bit in there because it allows for a few more carbs.
Yes.
But eliminate it. And it used to be ketogenic diet was used to treat diabetes and seizure disorders. So if we can really, really ratchet it down and eat the fertile fatty foods, get it down there. And if you need a little bit of insulin, great, some metformin or Glumetza or Avasitol, we're really finding that you have to be open to non-traditional acupuncture, meditation, light therapy, and oil therapy. And we have a great team of practitioners at all of our centers that are helping on that. So maybe one more question.
Yeah, absolutely. So let's see. We have a new one. Have you seen someone who recently turned 30 and has many failed IUIs and a couple failed IVF cycles elsewhere, and recently have a ectopic pregnancy, have success with frozen embryo transfer the next time around? And what are the chances of ectopic pregnancy occurring again?
Well, IVF has about a 4% ectopic pregnancy. We are finding that a frozen embryo transfer is a lower ectopic. That means that pregnancy is either in the fallopian tubes outside the uterus, basically where it's supposed to be. And if the tubes are bad, they should come out. That'll help. But if the tubes look normal, it's still reasonable that it can conceive either naturally or with IUI or an IVF. But if you've had multiple ectopics, IVF is going to be the best. And certainly it's a frustrating process. You know, if you're having 2 or 3 or 4 ectopics, especially with IVF, it may be time to take out the fallopian tubes and really reduce that. And whatever you can do to reduce inflammation.
Absolutely. Well, thank you so much for answering all of our questions. We had many, many more that we didn't get to that we will continue to work on. And like we said before, contact us at any time and we will work through that. We have a great, huge clinical team that can help you work through these questions as well. We have fantastic nurses available. Any financial questions, our financial and insurance teams are always ready and willing to help you navigate this process of making sure that we have the most affordable process for you to go through to conceive, to get that child that you want. Absolutely.
Well, again, a pleasure. Always open to questions, ideas, and how to do better.
Yes.
And we see patients Boston, Ohio, Michigan, New York, Florida, California, you name it, globally. And literally free Skype, free phones. It really is because we are passionate about what we do, wanting to provide the information, and whether or not you utilize us for your care or someone else, we want to help you on this journey, and grateful to be able to do that. So God bless to all, and thank you, Lisa. And thanks to Brad for helping us set this up, and we're always looking to improve, so take care.
Thank you.